we have seen over the last 2 decades, 3 decades, life expectancy go up, although it halted around COVID time. Um, but healthy life expectancy for the last 2 decades hasn't gone anywhere. So, and I think there was a report recently from Health Foundation that highlighted this element. And what we know is if life expectancy goes up and healthy life expectancy doesn't, that means people are living with ill health for longer period, which is not good, which also puts a huge amount of demands into our health and care systems as well. So we have a system sometimes where we keep people uh, living longer at the latter end of their lives through medical interventions and through medications and so on, which is great. But actually, what we want to do is to shift that more upstream and keep people living longer in good health. And so therefore, their healthy life expectancy goes up, and their life expectancy goes up because their healthy life expectancy goes up. And at the moment, currently, the healthy life expectancy is just hovering around between 60 and 65, and it's been like that for a long time. And if you look at the retirement age, it's actually above that. So in essence, you've got a retirement age that's tracking life expectancy, but not healthy life expectancy. Now, why am I saying all these things? Because physical activity and active travel and all the things that we're talking about here is absolutely fundamental in improving people's health and well-being and therefore healthy life expectancy. Chris talked about actually having if you were to bottle this intervention as a pill, you will get great investments, but actually this is a classic intervention that will actually add life to right at the beginning, if that makes sense. So I think that's really important. And one of the key elements that I want to talk about is having health in our policy and everything that we do in Oxfordshire through a model what we call healthy place shaping. We try to integrate that well-being approach. So that means considering physical activity, considering movement in that whole healthy place shaping approach. And the really good example of this is a couple of years ago that I did my Director of Public Health Annual Report on climate and health. And the whole point of that was to break down the silos between climate intervention and health interventions, because we saw climate interventions as, at least some of part of our population saw climate interventions as things that will benefit 10 years from now and actually will benefit a different part of the globe, different part of the city, not personalized. Whereas the point is that the same climate interventions are the interventions that will actually benefit you from a health point of view straight away. So being more physically active, being more taking on more active travel modes of transport will improve air quality, make the environment a better place. But actually, you will feel the benefit from a mental health, from a community integration point of view, straight away right now in at your doorstep. So breaking down those kind of silos becomes massively important. In Oxfordshire, we've got an array of really strong examples, and I think one of the things we have recently we've become a Marmot County, uh, uh, and that's because we do have some significant inequalities, whether it's in urban areas, whether it's in rural areas. Oxfordshire is one of the most affluent part of the country, but it has 10 wards, feature areas that falls within the 20% most deprived in the whole of England. And our health and care needs disproportionately come from these areas. So when we built active modes of transport, when we built better neighborhoods that encourages physical activity and movement, we don't see them equally. And I think it's really important that we address that issue. So, from an inequality point of view, on those 10 wards, we engaged with the community, we did community insight profiles, we mapped the assets that are available, and it was very clear that was coming out from those profiles. It is to be better integrated with the community, to be able to move more, to be able to have more opportunity to have more physical activity and so on. But sometimes we frame it quite differently. Sometimes we frame it as if it's either specific climate intervention or health intervention. It's either taking people off roads, it's anti-car, or it's improving people's well-being and being physically active. It's about giving more choices. So there was something about actually how do we improve and give people more choices became really important. We work with our partnerships really well. So we have a very strong partnership with Active Oxfordshire. Active Oxfordshire, particularly worked in our areas of deprivation. We have a project called You Move, which is all about people from areas of deprivation, giving them opportunities to take part in physical activity programs, giving them subsidized opportunity for leisure centers, although leisure centers are not the only options, but they could be a good way of actually getting people to engage more on physical activity. We also have something called the Bike Library, which is arranged by our really active community in Blackbird Leys, who are come from an ethnic minority community who are sometimes less confident about cycling and things like that, particularly girls, ethnic minority girls, and that has really grown and created sort of a social movement in that space. The last thing I want to also mention is the real power we have um, around the integrating with our health partners in this space. Health partners often seen as see things from a medical and clinical intervention point of view, but what we have is an opportunity to really show the benefits in terms of reducing hospital admissions and reducing health effects. And one of the programs that we commissioned was something called Move Together, which showed significant reduction in hospital admission. This is a program that was dedicated towards people with long-term conditions. It shows significant reduction in hospital admissions, significant reduction in GP appointments, significant reduction in falls. This really got our health partners to engage. And we're now having conversation around the new agenda on neighborhood health plans, around how to integrate moving more and so on. And then the last but not least, rural inequality is a real issue in Oxfordshire. We've got urban areas with inequalities. We also have a rural inequality as well. And I think it's really important that when we look at space, when we look at connectivity, we think about how do we connect people, how do we create those walkable neighborhoods. And we've got some examples in Oxfordshire where we have done that, or starting to do that. And that's one of the ways of actually addressing this issue in rural areas as well as urban areas.